Thanks, Sean. So I'm going to start on a slightly controversial note. It's not considered de rigueur for representatives of civil society organizations to start with even a mute defense of government. But I thought it might be a good idea to provoke discussion to start from there. I think it's important to recognize the context, particularly if you happen to work on water sanitation or hygiene. If you want to work on water sanitation and hygiene, particularly if you're working on sanitation, there's no better place to work on it than India at this point of time. Whether we like it or not, if anybody's worked on this issue, you would recognize that historically all of us have clamored for political will at a very senior level to try and drive issues around sanitation. And for the first time, we have this being driven from from the top. And there's a massive effort at trying to look at making India open defecation free by 2019. The fact is that, one looks at all these media reports, national dailies, you look at the press, and there's constantly reportage about SBM, mostly questioning whether India is going to become ODF by 2019 at all or not. And what I find fascinating is the very fact that you have so much media or press is in some sense a reflection of the fact that sanitation has become an issue that's important to everybody else. And if you didn't have a campaign, it wouldn't have become an issue which everybody would write about. So I think it's important to recognize that as well. I think the third is that we need to recognize that we operate in a federal structure. And you can have a national mission, but at the end of the day, you need every state to pick that up with equal emphasis and to drive that. The last is that I think we need to recognize that the one important difference in SBM in its current form as compared to what existed earlier at a national level is the fact that it actually looked at urban areas very seriously. Hitherto, a lot of the efforts on sanitation were limited primarily to rural areas, which did not necessarily take into account the realities of sanitation in urban areas. And in some sense, SBM has brought some focus to look at sanitation for even people from low-income families in urban areas. The evidence that is sort of by and large broadly used by government, is they're relying a lot on third-party verifications, independent verifications. Quality Council of India seems to be an agency of choice which does a lot of their studies for them. But I think more importantly, they just launched their National Annual Rural Survey on Sanitation, which is just taking place now. The trainings are happening now. And this is going to be repeated on an annual basis. And it's an independent verification agency that's been hired to do this. And in some sense, this is what's going to be generating significant amounts of evidence about what's happening in reality, particularly with regard to SBM rural. The sample set for it is fairly large. It's pretty much the same size as the National Sample Survey. So it's not a small survey. We're looking at 90,000+ households drawn through a fairly rigorous sampling process. So that's one part of it. The second is the government has its own verification processes. There is actually scope for improvement, but there is a need to recognize that. But one of the questions that often emerges is that when these verifications happen, what's the feedback loop and how does that feed back into the system in terms of change? There are also independent assessments that are constantly done. 3IE has done its own study. Unicef has done stuff on it. Center for Policy Research has done work on this. We've looked at essentially broadly three different kinds of studies around SBM over the last couple of years. Three of them have been large. Four of them have been largely driven by large, data sets, which is to go out, do a household level survey, and to try and collect information about it. One of them was generally to look at SBM, in sort of early 2016. There was a second which looked at WASH, particularly in the context of schools. We did a third on looking at WASH in healthcare facilities. We did another one on looking at hand hygiene behavior. And then we felt that, while these large studies had some relevance, but the fact is that we needed to find a way to sort of get this information turned around much faster. And so we started to look at rapid assessment. So we did one rapid assessment actually at the request of government to look at toilet technologies and the quality of construction that was taking place. And then we did another immersive study with IDS and with Praxis, which essentially looked at trying to understand why do people who, villages that have become ODF, what actually triggered in terms of behavioral change, enabled people to start to use toilets, if at all. One of the challenges that we are faced with is that when you have a program of this kind operating in mission mode, the appetite for pilots and long-term studies diminishes dramatically. At this point in time, if you would have a conversation with government about saying you want to do a pilot, you'll find no takers at any level at all. The reality of the matter is, for them, the clock is ticking. They have another 2 years, less than 2 years to go. So they need fast, quick turnaround, and they need really fast inputs. And they want them fast, and they want practical solutions to problems. They want solutions on how to fix what's not working, and they want that fast. And as a consequence, I think one of the things that we're recognizing is that there is a fundamental question that I think anybody doing research at this point in time on sanitation is going to be faced with. What's the right balance between conducting research and collecting evidence about what is not working and what needs to be fixed? And what's the balance vis-a-vis focusing on why things are working where they're working and whether we can learn anything from that to scale it up? Very often we spend a lot of time looking at what's not working and trying to look at how to fix that. I don't think we spend enough time trying to understand where things are succeeding, why have they actually worked in those places? And therefore, what is it that we can learn from that which can potentially lead to scale up within government on a much more rapidly? If we were to sort of look at some of the challenges that we're faced with for which we need some evidence and fairly quickly, I think, and these are not necessarily in any order of priority. One is there are huge questions around technology. There are questions around specific designs for rocky areas with hard terrain. There are challenges around technology for areas with a high water table and flood-prone areas. There are challenges around, there seems to be a sense that despite the government promoting twin leach pit toilets as an on-site sanitation solution, there seems to be an increasing creep and desire of people to opt for what they consider septic tanks. And I'm using the words very carefully. What people consider septic tanks need not be septic tanks, will actually lead to second-order problems because a lot of these are very often just containment structures. And so you're then going to have a whole new series of challenges in rural areas about desludging, about emptying out these tanks, and then finding ways to dispose of them. And we still haven't been able to figure out why is it that people are opting to do it. Does someone look at a design of a twin leach pit toilet which has a honeycomb structure with gaps in the masonry, which is part of the design, and say, we're well off, or we have an incentive, but this is a poor design because it's got holes in the wall, and let's just build a tank? We don't know what's triggering this off. But the fact is that people are opting in very large numbers for what are not necessarily the smartest solution. There's been attempts in multiple states around direct benefit transfer to look at funds being transferred directly, incentives being transferred directly to bank accounts of individuals. I know of at least 3 states which have either done this on scale or are attempting this. No one's actually looked at whether this is working at all or not. Where are the gaps, if any? Is there potential for this? Does it actually make sense to expand this at this point of time? On the incentive question, again, we're finding that there are different models that different states have adopted. Some states have chosen to say, we will only give an incentive to the community. So if the entire village declares itself as becoming open defecation free, then we will give the Gram Panchayat the incentive. Which means that in some sense it's a community incentive rather than an individual incentive. Then we have instances where incentives are actually staggered over installments and people and these get paid out. And the third is where some states have turned around and said we will actually give the incentive to the household but post facto. That you construct the toilet and only then we will give you the incentive. We don't know which of these is actually better. Which one actually makes more sense in terms of ensuring that you have better quality of construction and in ensuring that there is greater usage. That actually it's the response to build a toilet follows the decision to actually want to use one of those. There are going to be questions around equity. And there is a fear that there will be families that will get left out. Because historically, across all development programs, targeting has always been a problem for all government schemes. And we can't expect SBM to fix that. And the issue is then going to be, if in 2019 the incentives for SBM dry up, because if India becomes ODF by 2019, there are going to be no incentives available anymore. And if people get left out, and if they happen to be the poorest, then what happens? And so in some sense, there are real questions about how do we try and ensure that inclusion, equity is ensured, even if it's in the next 23 months. And particularly in the urban context, we have two kinds of issues that have emerged. One is largely around the management of fecal waste. And the second is this growing problem of looking at what's happening to sanitation workers. And there's a host of issues around sanitation workers, ranging from health safety to, the very fact that they're still, doing operations which in other circumstances could have been driven by technology. I think one of the challenges that we're going to need to recognize is that ODF can't be the end for any society, even if you work on sanitation. ODF is just one intermediate step towards safely managed sanitation. And I think what one needs to do is at this point in time start to look at, and government needs to also start to recognize that open defecation free is one milestone, but we need to look beyond that at ensuring that there's no slip back. If there are going to be problems with construction, faulty construction, that there's time and resources to fix that. We need to start to look at if people get left out, how are they going to be included as part of this. We need to look at institutions in particular because, at this point in time, there's a lot of emphasis on individuals, but one's losing sight of the fact that Anganwadi Kendras, hospitals, schools don't necessarily have great water facilities. And we'll have to start to look at issues around solid liquid resource management. I'll stop there and I'll take questions if any.
Afternoon all. Thanks for the invitation, and I hope we keep it interactive also. So I'll try to be a bit short. So I try to bring a bit of global perspective here. That's could be a bit my role. And compared to other places, I know about Europe, I know about Africa. I find India a good ground where we can use research and studies to leverage. And compared to other places, we have been trying we develop a lot of, as Unicef, a lot of evidence in many countries, but it doesn't translate into political decision and programming. And I'm fairly new in India, only like 9 months ago I arrived here, and I really found a completely different ballgame when you produce evidence with the various ministries with who we are working. So mainly Ministry of Drinking Water and Sanitation, but also Ministry of Human Resource Development or Health. Evidence is given consideration in some cases. I'm going to give some examples. So if we look at how can evidence leverage or change things, I would say there are three categories. One is on political decisions and political leadership. So if you look back at in 2008, you heard about the study from the World Bank, WSP, showing that India was losing something like $54 billion per year. This is like 6% of the GDP. I guess this is part of the evidence that convinced the government and the Prime Minister to take the decision to go for the SBM. We also conducted just recently a cost-benefits study on the Swachh Bharat Mission, showing that in full ODF environment, each household could save up to 50,000 rupees per year, considering life saved, time saved, just with sanitation. And this led to a statement from the Union Minister of Finance to sustain financial support on sanitation at medium term at least. So this is the advocacy for political leadership. I think it's important if you consider that you have, according to WHO, 117,000 children under 5 dying of diarrhea alone. In India, this is 22% of the global burden. If you have 39 or 38% of Indian children who are stunted, this is like an emergency crisis. So to me, the campaign mode is also well justified, but it makes it very difficult to have the second category of evidence influencing programming, which is to change programming, to adapt programming. So the good news also here about India, I found the door quite open. The discussions with the government is very regular, and I see very many things that have been influenced by evidence and dialogue by institutions like UNICEF, WaterAid, and others. I'll give you 3 examples. So the campaign was quite a race on toilet coverage and latrine construction. If you look at what the government is pushing for nowadays, it's still that, but also a lot of push on IEC and behavior change communication. And very genuine push on that. So the type of, just recently the ministry issued some guidelines to the states saying that if you don't spend 60% or more of the IEC funds, you cannot get the money for the toilet construction campaign. So so this is prioritized. It's all about interpersonal communication, building the capacities of the Swachh Garis, an army of Swachh Garis. 36 care resource centers were empaneled and trained. It's a system. It's not led by UNICEF or external agencies. It's internalized, and this is happening. And the third type of influence, it's something that maybe we should do more on this. It's all about evidence to foster integration. Just recently, the government released, I can't remember the title, but I read part of it. It's this report on the health situation in India. Do you know?
Yeah, NDC and PHFI.
All right. If you look at that report, the link with diarrheal disease is well noted, but not with stunting. When you look at nutrition, there is no way to say, oh, Swachh Bharat is going to change something. It's only about diarrheal disease. So, and more, I hear the ministry and the states want to have cross-data analysis where you see the trends in terms of sanitation, fecally transmitted infection, the prevalence of these, and water coverage, water quality, sanitation coverage, hand washing practice. So, and this, the issue of sanitation and other issues affecting children in India cannot be addressed by one sector alone. So this data speaking to each other is maybe lagging behind, and that could be a good way to engage governments as well as ourselves in more integrated approach to really address public health issues affecting most vulnerable communities. So this is something that we have planned to do in our new country program starting next year. And finally, something related to research, but something that works very well, I found in my small experience in India, it's the cross-learning, cross-fertilization. When you bring in the room practitioners, people that have good performances like district collectors with others that are lagging behind, I find really the cross-learning happening on fast track and influencing also how program is implemented, increasing quality and sustainability with all the issues that you just raised in your comments. So this is something that we also keen to work on. The government is developing a Google Wash where you have more of those knowledge products that can be shared. I was also asked to talk a bit about school wash, so I'll make a final point on this one. So on wash in schools, again, if you look at the UDIs from the Ministry of Human Resource Development, is rosy, shiny. It's 100% achievements, but then if you look at the reality and other sources of data, such as the ASER report, it's showing that 38% of schools still do not have separated toilet for girls, and that's an issue. There are huge issues of operation and maintenance, especially no funding for this, and we know that the construction of facilities is just one part of the solution. The success relies on sound governance systems at the school level and the little monies to allow for operation maintenance. And there are good news here. There is a district in Jharkhand that managed to use the 14th Finance Commission fund for operation and maintenance in school. That's one district out of 600. But it's a good example. It creates a precedent for that. So this is something that UNICEF will support. And a very good note on school wash, it's the importance given to menstrual hygiene management. Here, I really find that the government and stakeholders and NGOs are looking at this seriously. There are national guidelines. Specific indicators were included in the Swachh Bharat monitoring system on menstrual hygiene management. And just recently, yesterday, the state of Maharashtra indicated that menstrual hygiene management in each and every school in the state will be compulsory. So there is a good drive from the top, but we need to make this go down. And the main issue with school wash is how to demonstrate things. In my knowledge, there is very little evidence. Instinctively, you would say that school wash improves education and health outcomes for children, especially girls reaching the age of menarche. But Emory University has been doing some in-depth research on this topic in Kenya, in Mali, and it's not showing that there is a decrease in this area. On the contrary, in Kenya, it's even showing that more toilets and is linked to an increase of the prevalence of diarrheal diseases. This probably means that there is an increase in usage, but not in terms of operation maintenance. So that's a quite difficult area to prove something on. We all know that it has to be there, operation maintenance, and the school environment should be a clean place, promoting hygiene and dignity. But to prove the impact, it's a bit difficult. So yeah, thank you. I will leave it here for our discussions.
Great.
I have a love-hate relationship with social media. These days it's floating mostly in the direction of hate. But today quite a strange thing happened. I was sort of organizing myself to come here, and it suddenly struck me that I need to sit down and make some notes about what I'm going to say. And as inevitably happens, certainly with me, when I have something really important to do, I procrastinate. So I went on to my Facebook page. And Facebook has this really weird thing where it shows up memories of time gone by, whatever, this little thing that comes, which apparently is only for you to see. So strangely today, Facebook showed up, told me that 10 years ago, on this very day, I had published an op-ed in the Indian Express on sanitation. So I thought this is something here. It's worth clicking. Sometimes procrastination gives you good things. And I clicked on and glanced through what I had written 10 years ago. And just to echo what Madhavan was saying, the thrust of that article was that the really serious challenge of sanitation will only be fulfilled when, in fact, it was hooked on to World Toilet Day of a decade ago, and the point that I was trying to make was it's all very well to have seminars on World Toilet Day, but unless there's political will, nothing's going to happen. And ironically, a decade later, or a good thing, a decade later, there's an irony in it which I'll come to in a minute, but the upshot is a decade later, there is that political will. And when our funders ask us what is our impact, perhaps I can pull out that article of a decade ago and say maybe it contributed regardless of what the evidence is. But I think it is a really interesting and exciting moment, as both the speakers before me have said, that there is without a doubt a very, very high level political will and commitment to an issue that has in the past never really been picked up. I'm not quite convinced that this political moment is a consequence of evidence. I think this political moment is a consequence of politics, and it's important as people who work in the field of evidence to recognize that. Evidence plays an important role in shaping the outcome of what politics does, but I'm not quite sure that evidence necessarily shapes politics. Politics is a consequence of a whole set of things. Regardless, that politics has led us to having this conversation today and many other conversations on sanitation repeatedly over the last 3 years, and nothing but good can come out of that. Having said that, I then went, being spurred on by an article I wrote a decade ago and feeling pleased that there could be a policy impact narrative for my funders from that. I then looked at some other articles that I had written in the past on sanitation and found one where I had made a rather clever comment that, at least I thought it was clever at the time, that sanitation policy in India focuses a lot on, confuses accounting for toilet toilets as accountability for sanitation. That was a clever line, I thought. I don't see any claps here, but nonetheless. And one of the really interesting things, and there I think evidence has played a very, very important role in shaping how that policy, the politics is now translating into a policy narrative, is that there has been a decided shift, certainly in rhetoric, and to some extent in what we say we are measuring, and I'm using all these words very carefully because I'm going to come back to each one of these, in shifting the emphasis away from accounting for toilets to accounting for an output that emerges out of toilets, to accounting for open defecation free. Increasingly now, in fact, always in the last 2 or 3 years, when you talk about the Swachh Bharat Mission, you talk about ODF. It's quite amusing that when you wake up in the morning and open the newspapers and drink your cup of coffee and are probably munching on your toast, you also are reading about ODF. And the vast majority of India is now repeating ODF without blinking an eyelid. It's become ingrained in us. It's part of our vocabulary. And that, I think, is another very important achievement. My own sense is that this move towards ODF has very much been anchored in the evidence that was generated of India's past experiences with attempting to improve sanitation. There's the whole sort of history of a number of schemes that were put into place. Even though these schemes were not necessarily politically hot potatoes at the time, some movement had happened, some efforts were being put underway, and evidence was generated to suggest that the problem of sanitation is most certainly not a problem of access to toilets. It was a problem that moved far beyond that, and therefore the issue, the point of measurement should not just be the presence of a toilet. The point of measurement should be the usage of that toilet, which is where ODF as an output indicator emerged as an important piece, important part of the sanitation puzzle, and that has now got firmly ensconced in the policy narrative. It's also now firmly ensconced in the public narrative of sanitation. I think that's a very, very important and positive achievement of the evolution of sanitation policy in India and the role that evidence has played in it. But I also think that where we are today on sanitation presents us a very, very important public policy puzzle, which needs to be unpacked by thinking about evidence collection in a few different ways. Let me first put to the puzzle. The puzzle is this. When social scientists think about development and public policy, one of the questions, echoing the question that Madhavan was asking actually to some degree as he ended his comments, is under what conditions do policy ideas or policy design become successful? And in the context of under what conditions, we often look for what worked, and more often than not, we look for what didn't work, as Madhavan rightly pointed out. In many ways, a lot of what we've learned, especially from political science literature, tells us that politics matters. And in the current context of the sanitation policy in India, the politics is without a doubt just right. You can't get better than the Prime Minister of a country standing up on the ramparts of the Red Fort, urging India to join him in this movement to address the problem of sanitation. That there's no more there's no better politics than that. You also, to some degree, have an important policy design element right. In that, we have acknowledged that the goal is not to just go around constructing toilets. The goal is to move towards open defecation free. And in that context, we've also acknowledged, and the Swachh Bharat guidelines and everybody in the sanitation world will tell you that the way to achieve that is through tackling this rather complicated animal called behavior change. But the recognition that this is not a straightforward technocratic problem. It's a problem that requires a different approach and a different way of thinking. And in order to incentivize that different approach and different way of thinking, we have to start measuring the right indicator, which is open defecation free. That is now firmly ingrained. So in many ways, the conditions for getting the right outcome, I think, are most certainly in place to a degree. Yet, there's a lot of variation in outcomes. Madhavan talked a little bit about where things were going right. like a good social science researcher, I will now take you to where things are going wrong. And it's important, as important it is to understand where things are going right, it's also important to understand where things are going wrong to get a better sense of what's actually happening. In the context of getting these two critical elements of public policy right, we do still, I believe, have a vast majority of the country's bureaucrats focusing almost too much on toilet construction as the primary mechanism by which to achieve the indicator of open defecation free. And I think somewhere from the top to the bottom, the bureaucrat is getting fairly mixed signals. Mixed signals because while we are measuring open defecation free, and we have a gorgeous map on the Swachh Bharat MIS with GIS maps, etc., of GIS pinpoints of places which have gotten ODF, there is also a counting of toilets. When you start tracking the budget for Swachh Bharat Mission, you will find, as we have consistently over the last few years, it will be interesting to see whether the current order that the Swachh Bharat Mission has passed is going to change this. IEC money, the money that is allocated for behavior change, is a very tiny proportion of the total budget, and expenditure on it is even lower. These numbers have been floating around now for a while. The vast majority of the budget is for toilet construction. And the culture of the bureaucracy in India, as is the culture of the bureaucracy anywhere in the world, I've had the pleasure of being part of the World Bank's bureaucracy, and I can say certainly for a large global bureaucracy, that too was the culture, is to spend money. You want to access money and you want to spend money. That's the dynamic of a bureaucracy. And so the emphasis tends very much, therefore, to be on that money. Now, of course, there is flexibility. States don't have to, the guidelines of Swachh Bharat have been designed very carefully. They have given states flexibility. Some states are using this. But in a culture where access to resources is an extremely important part of how the entire system functions, when you have a target that is saying focus on behavior change, but a financial line item allocation that is relatively low, with a large emphasis, and somewhere along the line utilization certificates matter very much to how the bureaucracy functions, the emphasis tends to be very much on spending that money. And ultimately, budgets are also made and financial allocations are also made on your ability to demonstrate your spend. So if you're not spending, then the chances are that your next year's budget will be cut. And nobody likes a budget cut, certainly not in the Indian bureaucracy. This complex combination of confused signals, I think, has often led in places where you don't have champions, which is the sort of vast majority of the bureaucracy. You will always find really good champions in most places, but there is a significant proportion who function in a sort of business as usual way. The business as usual way of the system is getting these mixed signals and doing what it knows to do, which is to ensure that it spends money and moves quickly. And that translates into a very complicated set of outcomes on the ground. In some of the places where we've surveyed, the complicated set of outcomes that we've seen is that the provision of the incentive becomes a mechanism by which behavior change efforts are being directed. And so we have in the sites which we have studied, admittedly we haven't gone all over the country, these are in a few places, but what we've seen repeatedly is that the provision of the incentive is used by bureaucrats to try and engage with communities to build toilets, regardless of whether they actually have that pool of resources to offer or not. But that becomes a trigger, which completely undermines the core philosophy of what the Swachh Bharat was all about. The point, from an evidence point of view, the point I want to make here is this. When we think of evidence, it's very important to think of building evidence also as part and parcel of process tracing and process tracking. So tracking budgets gives you a really good sense of how the rhetoric maps on to where the actual decision-making authority and decision-making incentives are going to lie in the implementation system, and I think that's a very important part of the evidence-building narrative. Tracking how bureaucrats behave on the ground, how implementing officials behave on the ground, through often deep qualitative interactions, observations, and engagement, is also a really important way of trying to understand how the idea of a policy and how the tools that are given to the bureaucracy to implement that policy policy actually get translated on the ground. So along with understanding impact, understanding process is really critical, because in these processes lie the hints of why the impact may not be as you have desired. So it goes back to, and it helps start unpacking this policy puzzle where you've got a set of conditions right, but you have a lot of implementation gaps. Where are these implementation gaps coming from? The other really important thing to understand is that in the current way, mission mode operation of Swachh Bharat, in a world where you have a deeply broken state capacity system, I don't think anybody would challenge the fact that India's state's implementation capabilities are extremely weak. You end up with this really interesting paradox. A mission mode really gets the system to start moving. I worked very closely on the NREGA a decade ago. In fact, most of what I did write a decade ago, and obviously didn't post it on Facebook because it didn't throw that up to me today, was on the NREGA. And so I often, when I'm looking at Swachh Bharat now, make comparisons with the NREGA. A decade ago, NREGA was a political mission for the UPA government. Every district I traveled to where you had a district collector that was keen to do something and sort of make a quick impression in the short period of time that they had in their district was focusing entirely on getting NREGA right. And to get NREGA right, they made the very sensible, rational calculation, which is what I would have done too if I was a district collector, which is to say, I want to just make sure that I get this right, and I'm going to get all my officers, regardless of what they are up to start focusing on working on NREGA. Some of the best case examples of NREGA in the early years between 2006 and 2009 were places where everybody from the junior engineer to the Anganwadi worker was standing on the NREGA site trying to get the scheme going. It's exactly the same right now with Swachh Bharat. So the mission gets everybody mobilized and gets things to happen in a system which is very broken with very, very limited human resource capacity. But what the system also does, therefore, is that this kind of mission mode does is that it prevents the system from actually addressing the hard problems. Behavior change is a deeply hard problem, and it may actually require a whole host of different kinds of experimentation and approaches. But it's very difficult to try those experiments and approaches when A, you're a set of bureaucrats, i.e. technocrats, who are suddenly now being told to go and talk to people and convince people to change behavior on an act that is actually a deeply personal, private matter, which, as we know from all the evidence, embedded in a whole range of social and religious contexts. You're also asking these people these technocrats to do this with very little training in a particularly short period of time. Everyone is operating in a target-driven mode. You need the targets to get into a mission mode, but the minute you have the targets, it means that you have to get things done in a hurry. So 20 days ODF, 30 days ODF, 2 months ODF tends to be how this is translated into the minds of the implementing officers. And the implementing officers then are moving to get things done as quickly as possible. And in that way, in attempting to do things as quickly as possible, they end up doing precisely what I would do if I were them. Take the one thing that you know, money, and use that as a mechanism by which to get some things done. There's also a third problem that comes with this, which is that it tends to undermine the system's ability to really strengthen the very institutions that are needed to get this right. I recall in the NREGA days, some of the star NREGA commissioners saying to me that I will not give my NREGA to those gram panchayats because they will run away with the money and ruin my program. Although it was enshrined in law that 50% of the NREGA funds would actually be spent by the Gram Panchayat. At the heart of SBM is a strong local body. You cannot have a community-driven program. You cannot have a program that is anchored in community change without having strong engagement of local governments. You will, of course, find strong engagement of local governments in some parts of the country, but in the vast majority of the country, the local governments have become yet another implementing agency of the district collector and the block development officer to get the target right. The local government doesn't really have the kind of role that they should have if you were to do this right, and if you were to do this in a way that in the long term is sustainable. And again, from the perspective of the BDO and the district collector, it makes imminent sense. I am in mission mode. I have to get things done fast. It is true that capacity on the ground is extremely limited. This is not my opportunity to build capacity to reach an outcome. This is my opportunity to just get there and get there with whatever means we can. I think as a consequence of this, we may run the risk of undermining some of the core institutional systems that we need to put in place to actually get this done and get this done right. And here again, I think evidence could play a very, very important role from the point of view of tracking processes and from the point of view of trying to highlight the possibilities of what institutional systems can do and the consequences of what happens when institutional systems take a shortcut route to achieve a long and complex goal. And one final point, when we talk about evidence, we often think about evidence very much in terms of what all of us in this room want out of evidence. We want to understand consequences of actions. We want to look for causality, and we want to understand whether policy design leads to the kind of outcomes that we have in mind. But evidence also has a very, very important role to play in everyday decision making. How do you, it's very important, especially in a program as complicated as Swachh Bharat, to think about evidence in a way that would be useful to the implementing officer to be able to take the right kind of decisions that they need to do on the ground to adjust programs in a way that makes sense. India is a deeply centralized system. I think one of the factors that feeds into our centralization mentality is that there is not enough information available at the local level for local stakeholders and local actors to exercise discretion. And so they just choose not to exercise discretion, and the default is to prefer a guideline-driven centralized system. One question that we do need to ask ourselves is, if you're a district collector, if you're a block development officer, if you're a block pradhan, if you're a gram pradhan, what is the kind of evidence that you would need to be able to figure out what should be the right kind of approach I need to make in the particular place that I am going to be able to achieve the target of ODF and hopefully the outcome of public health. It's very interesting to me that very rarely do people talk about the importance of measuring public health outcomes as part and parcel of how we need to measure the impact of sanitation. Ultimately, it shouldn't be about ODF, or it shouldn't be about solid liquid waste management. It should be about a whole range of things. But where we want to get to, the reason why the state can get into our homes and really park itself into one of the most private activities that should really be individual choice, is because there are very serious public health consequences. That's the reason why a block development officer and a gram panchayat can knock on people's doors and ask them कि आप कहाँ जाते हैं, and that's the reason why all the BDOs of the country are currently roaming around doing what they call morning follow-up. If we are not going to measure the impact of that from the point of view of the rationale for why the state should be in this in the first place, the public health story, then I think we are missing on the most important part of this piece. And it's equally interesting to take it back to processes and back to what's happening. The health ministry in Delhi and the drinking water and sanitation ministry in Delhi don't necessarily talk to each other very often, and certainly are not talking to it. We don't have any disease tracking anyway, except for a few occasional studies, but we're not really talking about how to address this gap. I think that's a very, very important piece too of how of the story of evidence in sanitation. I'll stop here.
Hello, everyone, and thank you for being here to discuss SBM. As my fellow speakers or the speakers before me have stated, it's very hard to avoid any discussion on SBM nowadays. It's on our currency notes. When you're traveling down a highway, there are boards on SBM. It's very difficult to avoid the sanitation message. Each of the speakers before me has addressed the issue of evidence. When it comes to the SBM, what evidence is available? And so the speakers before me have talked about evidence that's available from the Unicef reports, or Madhavan talked about the National Annual Rural Sanitation Survey, which will give us evidence in terms of latrine use and the status of latrines in the rural areas. We'll have evidence on that. And then Yamini even mentioned Facebook-related evidence, which was also interesting. It's not an example one hears often, but still counts. So I'm here to talk about 3I's kind of evidence, which is the rigorous counterfactual evidence. So this is when we look for the impacts of a program, we're trying to figure out what are the outcomes from a project or an intervention or even a mission, what are the outcomes that we can tell. But in order to be able to do that, we need to be able to look at a counterfactual or a comparison group that is comparable to the group that is undergoing the project or the intervention. And so at 3IE, we count that when we have a comparable comparison group or a counterfactual. It is at that point that you compare them, they're equivalent at baseline, and therefore at end line, the only difference between the two groups, when the only difference between the two groups is the intervention itself, then we have what we call rigorous evidence. So when it comes to sanitation, 3IE has funded over the years many impact evaluations across the world in LMIC, in low and middle income countries. We have funded many impact evaluations as well as systematic reviews of the evidence on the effects or the needs of the sanitation sector, the wash sector as a whole, in fact, not just limited to sanitation. And one of the things that has emerged from all of our lessons learned or all of the evidence that we have gathered, that there is a great need for evidence on behavioral factors that determine the uptake of wash technology across the world in all LMIC countries, not just India. But our efforts, I think, have reached a special momentum in India itself. So having learned from all of these studies that have been done in the past, not just by us, but by other institutions as well, our most recent efforts have been focused on the issue of latrine use in India. So SBM, as the speakers before me have mentioned, focuses very heavily on the construction of latrines across the country. If you were to log into the SBM website, you would see that in the past 3 years of the SBM, we have moved significantly from where we used to be on 2nd of October 2014 to the current status where we are, where currently latrine coverage is supposed to be around between 60 to 70%. So there's been a huge jump, at least as per the SBM website. However, the Secretary of the Ministry of Drinking Water and Sanitation, who's also responsible for the SBM, has often said that it's a mistake to assume that the government is only interested in constructing latrines. Basically, the SBM is also interested in latrine use. What is interesting is how they measure latrine use, and that is the percentage of villages or districts or states across the country that have declared themselves ODF. So that is how the government chooses to measure latrine use. And they suggest that who says the government is only interested? This is a wrong assumption. We are actually interested in the number of villages and geographic areas that are declaring themselves and subsequently being certified as open defecation free. And as you know, the goal is that by 2019, the whole of India, which is such an ambitious target, the whole of India is expected to be open defecation free. So at 3IE, we focused our efforts on latrine use, perhaps differing a little bit from how the government chooses to measure it. We are focused on latrine use because we think it's an important part of this whole Making India Open Defecation Free campaign. So we hope that our results will inform sanitation policy. What we're expecting to do is using behavioral science, which I'm sure, as some of you know, has caught the policy imagination pretty broadly. I mean, almost, I think every other week I read about government setting up nudge units, which are very common, which is probably the most popular element of behavioral science. But we're using or encouraging our grantee teams to use behavioral science approaches because latrine use is a behavior. And as my colleagues have mentioned, it's extremely private. And this is one of the reasons why it is very difficult to collect accurate data on latrine use. Because when you visit a household and ask them, are you using a latrine or are you defecating in the open, it's a very hard question to answer. The household probably feels pressured by the fact that they may have received or may be expecting to receive a subsidy, the 12,000 incentive given by the government. You could be from the government and asking questions, and so it bothers them. Plus, they probably know what the appropriate response is to the question, and it's very hard not to give the appropriate answer, which is, yes, of course, we use the latrine. So it's extremely private behavior. And so in designing this program of evidence, we were trying to figure out what are the best ways to collect evidence on this front. So not only are the 4 teams that we are funding in 4 states of India, they're not just looking at designing interventions which will increase latrine use, but we've also gotten into this very complex question of how do we measure latrine use, because a lot depends on how the question is asked. So if you were to ask a household, did any of you defecate in the open today, you may get a very different response from asking each member of the household, Did you defecate in the open? I mean, where did you go in the last 24 hours? So there are many different ways to ask that question, and unfortunately, any of the evidence that currently exists on this subject has asked that question in many different ways. Thus, how far these results or this evidence that we have on latrine use, how far are those comparable? It's really hard to say. One particular survey that the Secretary likes to mention suggests that latrine usage across the country is 95%, which is fantastic. Then we probably don't need a Swachh Bharat Mission even, right, except for providing the latrines. So we're hoping to contribute to some of the evidence that we have on the subject, both in terms of trying to accomplish behavior change. There are many reasons, as you can guess, that people don't use latrines. Some of them are related to infrastructure. So the presence or absence of latrines are definitely important. So latrine coverage does play a role. But also where latrines exist, we don't really know that they're usable. Sometimes they're cramped, windowless sheds where the state government, I think one of the challenges is that sanitation is a state subject. So the SBM at the federal level or the central level can say what they want, but ultimately the implementation depends on what is happening at a district level and at the state level. So in some states, they've chosen to fund contractors to go out and build these latrines, which are way less than ideal, which probably means that even though those latrines are constructed, people continue to defecate in the open simply because it's not convenient to use those latrines. Usage of latrines is also associated with keeping the latrines clean, which also come with implications in both keeping them clean and maintaining them, which often is a responsibility that falls on the woman of the household. So it's not surprising, perhaps, that in some cases when you talk to the women of the household, they would prefer that household members go outside as usual, because here's another responsibility. Everybody in the household uses the latrine, and guess who gets to clean it, right? So there are a number of issues, I think, that our 4 teams are trying to address. We're hoping to have the evidence on this front in 2019. That's just how this program has developed. How far does that become useful to us? Because as we know, the SBM ends in 2019. Even assuming that India becomes open defecation free or is declared open defecation free, I think our perspective on this is that we are going to run, as brought up by Madhavan, I think earlier, we're going to run into issues of slippage, or we're already running into issues of slippage where villages are declared and certified to be open defecation free, and then somebody happens to make a visit and then realizes actually there are toilets that are not being used and there are visible signs of feces all over the place. So we're hoping the evidence on behavior change, we're hoping to contribute to the evidence on how do you measure latrine use accurately? How can the questions be asked in a way that are less intrusive or are less biased towards forcing households to respond in the affirmative, even when that is not the case? These are all really complex issues, but we're hoping that our evidence will point in that direction. At the start of this program of evidence, we had done a scoping study where we had tried to look at the rigorous evidence available within India on latrine use. And actually, we were only looking at quantitative studies, and we actually found that there were only 4 studies that included any kind of a counterfactual. The scoping study is available on the table outside in case anyone's interested in reading it, so you can read more about it there. But it did emphasize to us that there is a great need for this kind of evidence. Along with other types of evidence, there is a great need for this kind of evidence, both qualitative and quantitative, to be able to push us in the direction of becoming actually open defecation free and not just declaring ourselves to be open defecation free by a certain deadline. So I'll stop there.